Yes, there's a broadcasting. The main audience is online. The main audience is here. Well, thank you very much for coming. Yes. It's a good point. Unfortunately, I don't see the rest of the audience, but whom I see, thank you very much for coming. We've been here since 8 o'clock in the morning, and it's a good point. You're all young, beautiful, and as unfortunately, I don't see the rest of the audience, but whom I see, thank you very much for coming. We've been here since she repeats 8 o'clock in the morning. Okay. As we are all here, I hope that you are very much interested in your health, exactly as we all are in ornament. And health is something, it's a unique gift given for granted. And unfortunately, as we are approaching by November, we will be 8 billion inhabitants on the earth. Mostly of us thinking about our health caring just in the moment of getting sick, unfortunately. While it's truly easier and cheaper to be healthy than to treat any disease. Look at this couple. They're smiling. They're talking about something nice. What they're talking about, not about disease, I guess. They're talking about health. They actually develop a plan to maintain their health. Isn't it good to meet the patient like this? Smiling, sexy, nice, talking. While in the curative medicine, and we are getting used, we are going to the hospital when we are extremely sick, we already don't have any health, we don't have any forces even to look at their faces. They're all stressed. And nobody knows what will be the outcomes of this disease. How many time will be, how many days, how much time will be needed to get back healthy. And of course, the costs are incomparable. This is the daily cost for patient to stay inside the hospital. That this is the average for the United States. Of course, it's the average. If you take California, for example, it's more than 3,000. If you take Ohio, it's less, but still the average is more than $2,500, more than $2,500. While to be healthy, to maintain a health, it's from $50 to $200 only a year. For this cost, a person can make all necessary blood tests and get also some improvement if necessary, to take vitamins, supplements, and to maintain their health until next year, until next checkup. Therefore, preventive medicine, and we are talking here about preventing diseases, costs nothing compared to the curative one. This is the basic principle, and as simple as infusoria, the basic principle of ornament. And we are all here to share it with you. Well, think about the situation when you have done all the blood tests and you get the results and everything within normal range. And you feel yourself a little bit strange. You say, well, I just spent 150 euro and everything is normal. Isn't it ridiculous? You feel yourself that you're a little bit being fooled. Don't allow these feelings, because you just made a good investment in your own health until next checkup, until next year. Because you take the vehicle inspection, right, of your car or motorbike time to time. Please do it for your health as well. Take a full checkup once a year. I'm not telling you something which you haven't heard before. That's all very known things, right? You've heard about this. This is the data from World Health Organization, and they're talking about 10 leading causes of death. And among the 10 leading causes, the number 1 is a heart disease. The second is cancer. And I explicitly put it the number 8 disease. And I'll explain you a bit later about why. It's diabetes. Because it's chronic and very complicated disease. And it's growing very badly with an enormous speed. The bad and sad news is that these all curable diseases, if diagnosed on time. And the good news is that these are all curable diseases if diagnosed on time. Number 1, cardiovascular diseases is the leading cause of death globally. As we're talking here, every 34 seconds, 1 person dies because of cardiovascular diseases. 85% of all these cases is infarction and stroke. And the sad thing is that mostly all these diseases might be prevented by addressing behavior and dealing with behavioral risk factors such as tobacco smoking, unhealthy diet and obesity, physical inactivity, and using and consuming a lot of alcohol. I would add something else, introducing a healthy habit to take and control blood tests while we are still healthy. Behavioral risk factors, which we already mentioned, as the sedentary lifestyle, alcohol abuse, high cholesterol, smoking, etc., they're leading to high blood pressure, high blood glucose, high blood lipids, overweight, and obesity. And if we take a healthy habit to control all these biomarkers, we are on a good stage to control all these diseases and unfortunate risk factors which can drive us to tragedy, to the diseases which we cannot control, to the mortal diseases. What is wrong with being overweight? Being overweight is increasing a lot cardiometabolic risk factors as insulin resistance, as blood pressure, inflammation, dyslipidemia, as we see high cholesterol, many of us today, endothelial dysfunction, and type 2 diabetes, which eventually outcome in cardiovascular events, sudden death, and heart failures. So everything is linked. Cancer, number 2 of leading cause of death globally. And unfortunately, patients come to the hospital in quite late stage when there is nothing to do. They're coming in the 4th and terminal stage of this disease. Still, they come to the hospital and diagnose it for the first time because they don't have annual checkups. They just avoid to go to hospital and check the biomarkers while they're still healthy, why they don't feel any symptoms yet. And the most common cancer types for men and women, you can see here. Again, in 30 and 50% of cancers could be prevented. This is the saddest thing because it's again data from the World Health Organization. People come too late when they already develop cancer. They don't come when they're healthy to control themselves. And again, the reasons: if tobacco, is alcohol use, some infections as hepatitis and human papillomavirus, occupational cancerogens as asbestos, but probably that was in the past, not anymore in the modern world, and radiation. So you can see that this disease could be also controlled and prevented. Then what is happening? Why people come late? What's wrong? As we're talking here in a very intimate atmosphere, I would like to share with you the biggest secret of the medical business projects driven by the most expensive private clinics. Do you want to know their secret? They know exactly what is happening inside the mood, inside the mind of a sick person. It's a psychological trick. Sick people don't like themselves. They hate themselves. They don't love themselves. They say, "Ha, you're ugly. Your body is ugly. You deserve it. You deserve it. Oh, you're getting even sick. You deserve it. Because you're ugly, you deserve it." They don't love themselves. It's a psychological trick. And the businessmen who are driven by the medical business driven by great minds, they know exactly this trick. The funny thing is that these people who hate themselves, they love their pets. They're taking care about their kitty and doggy. And if something is happening with the pet, they immediately bring it to the most expensive veterinarian clinic and treat it. They like it. They like them. They take care about their pets, but they hate themselves. They never come to the hospital. And even if they already feel not so well, and you say, "Why don't you go? You probably have diabetes." No, I don't have time. I have to divorce first. I have to do something. I have to treat my kitty. Then maybe, and never come. They come too late when there is nothing to do. What do we do in ornament? What do we do to prevent cancer? We do a lot of things. We control. We created the personal checkups for each of us according to age and different age and different sex. We created a huge programs in order to check and maintain biomarkers within the normal range. Breast cancer screening, cervical cancer screening, colon, lung, prostate cancer screening. We control biomarkers while we're healthy and don't have any symptoms. That's why we sleep well. Here how it works. This is ornament. And you see the personalized checkup according to what we need. This is the woman, this is me. And I have mammography because after 40 years, mammography must be taken every year or twice, every second year in order to control breast cancer. And it really works. Since mammography as a screening test was adjusted, the year they started to perform this program was 89. So many human lives were saved. More than 432,000 lives were saved from the death. And these are the data just recently published in High Impact Factor journal. So it really works. After the age of 40, every woman must be controlled. I'm going to show you something which is a sad and beautiful story. It's a tragedy again. In 2004, the leader of American group. Oh, we don't have a sound here. This is Adam Levin. You remember this song, right? So he said, in my clip would participate the most beautiful woman is the John Travolta's wife, Kelly Preston. She died because of too late, because of being too late. Diabetes, I promised it will be number 3, even if it's number 8 according to the World Health Organization. Diabetes escalates from epidemic to pandemic right now where we are talking. We already hate this word, no? Pandemic, because of another disease, because of COVID. But this disease, diabetes, is not spreading because of coughing to the neighbor. It's spreading because of our lack of time, because of our bad habits. It's spreading because we never have any reason to go and check the blood glucose. We come too late when there is already diabetes and there is nothing to do. 1 of the 3 Americans born in 2000 will develop diabetes. It's more than 60% of the whole inhabitants. When I entered to the medical university in 95, we've been talking about 100 million patients in the world. Right now, we are more than 550 million patients worldwide, and projected is even more. I can show you in a second. But it's everywhere, not only in the United States. In Arabic countries, it's the same. This is Emirates. And we are already thinking and having in our spinal cord, we believe that Japanese is the healthiest population in the world. Look at them. It's more than 30% of Japanese population having or will develop diabetes number 2. It's because of the lifestyle change. In Europe, Germany is the highest prevalence of this disease. And the number 2 is Portugal. Predicted in 2045, there will be around 8 million patients with this devastating and very dangerous disease. Why this disease is dangerous? Because it creates metabolic changes which lead to infarction, stroke, kidney failure, amputations, blindness. People are blind. They don't have vision anymore. And they're all overweight. Obesity is the central, let's say, factor in this pathogenesis, in this pathological loop. And once the patient is obese, type 2 diabetes, cancer risk, heart disease, reproductive disorders like infertility, it's all there, liver diseases. How ornament takes care about prevent all these unfortunate situations and these real diseases, mortal diseases with a high risk. We are based on the evidence-based medicine. We respect them, and we always follow top 10 clinics, worldwide clinics, as Mayo clinics, because they do a lot of interesting research. We trust them. Clinical trials, and we always put personalization. Everything we recommend is personalized. That's why all of you who has downloaded our ornament application had to go through the questions in order to personalize your own needs. This is the team of our professionals, the medical doctors all over the world. And these are the examples how we decrease the, for example, heart diseases. We improve and maintain and control once a year, if needed twice a year, cholesterol levels, as you have done this morning. We control blood pressure. We allow our users to get active and follow a heart healthy diet and get a healthy weight. Our user might get into special programs, which is 30-day special program to lower the weight, or they can do the intermittent fasting. This is our application. We control diabetes and we manage stress and anger. We even allow people to sleep well. With us, they improve their sleeping. I hope you all downloaded Ornament, you are getting familiar with it, and you will stay with us and be healthy. Thank you very much. Questions? If no questions right now, think of them, and we are here with you.
Thank you very much, Alina, for this good mood for the whole Friday. No, actually, I mean, powerful stuff. So we definitely need to think about our health. By the way, my name is Elena. Who doesn't know me? The last time I spoke at an Exness event was in 2020 when I was hosting Exness Week in Malaysia. And I'm really, really happy to be back in another role, in another company, but who is a partner of Exness, which is Ornament. I am really happy. I will be really happy if you all download Ornament. And it's a paid app, but for Exness, our partners, for all of the employees, it's free. You have access to all of our features. You have access to all of our features. We have already a lot of good stuff in the app, which my colleague, our business development officer, George, will talk about in a minute. And something else really cool in the pipeline. Okay. While they're looking for our presentation, I'm gonna, vamp for a little while. I don't know. When was the last time before today? When was the last time you checked your blood? Okay, a month ago, 2 months ago, a year ago? Both? 1 year. More than 1 year. Okay. More than 5 years. Never. Yeah. The rest just never checked their blood. The last time you checked your blood was in school when they were doing this, little checks that you hate, and sticking a needle in your finger. Okay, everything's broken. Hi guys from Malaysia, I miss you all. Okay, so I don't know, how are your results, by the way? Did you do the checkup? Okay, did you get your vitamins, the certificates for the vitamins? Funny story, we actually shipped the vitamins and they were supposed to be here and we were supposed to give away the actual vitamins today, but it's Cyprus, so they arrived this week's on Monday morning. And then they called me and they told me that customs are not releasing them because they need to be checked by Cyprus Health Department. And Health Department comes, thank you very much. Health Department comes only once a week to check every package. They didn't have time to check ours. They already came. So the FedEx guy came every day to the customs, to push, to find somebody to check our shipment, but unfortunately it didn't arrive. So, but anyway, we have our certificates. If you haven't gotten the certificates for the vitamins yet, please come with your Ornament Health installed. Our beautiful and amazing Dr. Elena will check your results and will give you several sets of personalized vitamins. But I'm not going to spend a lot of time talking about Ornament. I'm going to say that everybody is basically sick. Something is wrong with you. There is not, I'm from a medical family. And when I ask like my mom or my dad, what is like the highest grade of health, like when a baby is born, they grade the baby on a scale of from, 0, obviously not, from 1 to 10, and nobody gets 10 ever. It's like the highest is like 8 or 9 out of 10, never 10. And as we grow, our health deteriorates. So we need to always keep constant check of what is happening with us if we want to live like 100 years. So because the world is getting sicker, and it's right now is sicker than it has been in 100 years. So technologies are to help us are developing at an increased pace. And Ornament is one of the best tech companies to support, to help you control your health. As Elena mentioned previously, is very complicated and is very expensive to treat something that is already hurting. So it's better to prevent, and it's much cheaper. So yeah, and if we're talking about financial terms, since we are a financial company here, and you're probably interested in money and investment possibilities, like 13.7%, like more than 10% market growth is a good growth in the last 5 years, and the market is projected to be over 400 billion by 2025. So, and 1 in 3 smartphone users, like more than 30% smartphone users, they're using like more than 3, usually 5 wearable devices. What wearable devices do you know? Like your smartwatch. So anybody have an Aura ring? No? Aura. Have you heard about Aura? You should check them out. They're cool. Like they're beautiful, and they have a really deep tracker of your pulse and your blood pressure, I think. So Elena already spoke about this. So Gosha, if you'd like, just tell us a little bit about the functions that we have in our app, so you can start using it on a daily or at least weekly basis.
Hi everyone, I am Georgi, George. So I am also part of the businessman, business developer, and part of the product developer guy here. And regarding the app, so now let's talk something about that. To be honest, I don't want to already on the fifth cycle row share with you our functions. I just want to share you the exact what the cool things Ornament can do for you. As Yelena asked you before, only one person in that room made blood test 1 year ago. Yeah, that's the reality. I was the same. So now I'm 30 years old. I am not, to be honest, very much thinking about my health. I am pretty healthy guy. I am do sports and etc. But I want to show you the difference of me before starting working with Ornament and after it. You will not see my 2 pictures compares, like where I am fat and ugly and like where I am like a Johnny Depp, etc. But I just want to share you. It's my profile here in Ornament, and I just want you to see how now a lot of data about me I know exact my biomarkers data. You can see how much time I need to list my screen. This all about my biomarkers. And it's not because I am really something like biohacker guy and I am charging myself in a Tesla charging stations to check my glucose level, etc. But I started to understand that knowing about the knowledge about your health, it's the most important thing. That's all. After even after you have a child or you have a wife or you have a husband or whatever, you need to start thinking about your health. That's why I just we started to think how we can help you and started doing ornament. So you know that we are all about the blood, about the biomarkers, about the health data, and etc. But also we want to be a casual. We don't want to create an army of biohackers and etc. That's why you can see like a lot of separated screens with our different functions. Started with like checkups, post-COVID vitamins, future mom, and etc. Some casual things which you don't need to do a lot with your blood. You just need to activate this package and solving your concrete task. Yeah, like vitamins level, and also we have free vitamins for everyone. After my speech, please come to us. We will give you some casual articles to read. The doctors with Elena, like our head of chief of our medical department. And so we have like 2 million installs already. So people loves us. Yeah, this is Aura. This is the ring. Yeah, this is the ring. They are not our partners yet, but we both of everyone of us believe that this ring is very cool because you don't need, at least you don't need to charge it every day. Yeah, everyone knows who use our. So Exness is data-driven company. Ornament is data-driven healthcare company. So we have a lot of also partners. For example, the vitamins which we share with you is from our Vital company. It's United Kingdom vitamins. They provide personalized vitamins based on your blood tests, etc. Now we just give you something like already. Help me with English. Как будет собранное уже заранее? Собранное. Gathered, yeah. Pre-gathered package, yeah, without your blood test. Yeah, and so we believe that preventive medicine it's on rise. So we don't want to cure you. Cure is old school. It's cool to be healthy, fit and healthy. That's all. Thank you. Questions?
Yeah. Everything. Everything. So what you do, you install the app, you do the onboarding. Then when the app asks you to pay, you skip it. You just close it. Don't pay. Don't take and don't activate the trial. Don't activate the trial. Don't pay. Just close the payment, the paywall, and text our support is very easy, just 2 taps. You can just write Exness or hi, I'm from Exness. If you're feeling, you know, if you're feeling playful, you can write something else, but just mention Exness. Yes. And yes, for everybody, mention Exness. And you know, and you will get access to everything for free. Yeah.
Be patient
Yeah.
at least for 30 minutes.
Yeah.
We do it manually because our support team has to check Exness, has to ask our also financial team to activate your training account. It's not like.
Yep. So, and also once you download the app, you can upload the results that you got here and they will show in your biomarkers. Also give it some time because it's checked and digitalized to sometimes it's checked manually also by a team. And come and get your free vitamins here at our booth. And That's it.
Yeah.
Thank you all. We are ready to help you at our booth. Come, with your coffee, discuss something. And yeah, thank you all for listening. Bye.